Not every doctor is for every patient. Not every patient is for every doctor. And so, for example, we do a lot of our communication in the patient portal. All right. We find that because we're a boutique practice, we're smaller by design. It is more efficient for us to do communication through the portal than we're not trying to robocall you while you're at work or do something like that. Now, of course, there are going to be conversations that must be had on the phone or must be had in a virtual consultation, and we'll set those up. But the majority of the, communication is happening in the patient portal. So if you're a patient that, wants to be called with every single thing, this is probably not the best fit for you, and that's okay. But likewise, if you're somebody who doesn't like to answer the phone, I'm looking for that portal message. And so I think that's an important point too.
Yeah, or you're at work, you're not going to be able to answer the phone.
That's it.
If it's people in the portal, you get to control where and when you see that information.
That's correct.
So I think a lot of that is awareness too. What information am I getting? Who's giving it to me? How am I receiving it?
Right.
And does that make sense for me? And you and I both feel strongly, it's okay if our way is not the right way for you.
Totally.
We can't. That's okay.
Totally.
But you have to have that insight and the awareness. And it's hard to ascertain that information from a clinic unless you ask.
I think that's right. I think that's a good question for people sort of up front. How do you deliver results? And I think you also made a good point that I'm going to piggyback off of, which is the patient being able to control when and where they receive certain information. Because just because it's convenient for the nurse from whatever clinic to call you at 2 p.m., you might be in a board meeting. Do you want to take a call that you're not pregnant at that point, right? And so I think that there's a lot.
But if you don't answer it, are you not going to get the information?
Right, that's exactly right. And so I think there's a lot to be said for asking those questions.
I also think when it comes to just who you're seeing, if we're staying with this IVF realm, in your care. So we do where each patient's assigned, obviously, a doctor, even though we both see patients in cycle. We are very different people, but we practice very similar medicine. So you're getting the same medicine, even though we may approach things a little bit differently, right? And everybody knows that, and that's fine, right?
Yeah.
But also, every patient also has a nurse. So you know who your nurse is. This person's doing your teaching. They're making your calendar, who you're going to with primary questions. But that's also not how a lot of clinics are set up.
Absolutely right. And so, we think it's very important. So you have a primary doctor, like you said, like we take care of our patients together. We practice together. It's a partner practice. But, if it is someone who saw Dr. Crawford as a new patient, when we need a new plan, when we need a new visit, they go see Dr. Crawford for that plan. However, we're practicing together. But then, you also have a care team. So to your point, a cycle coordinator. So, your team, Skillern and Ricky, for example. And then that's your primary point person. Everybody is everybody's patient at Fora, but there's
the family.
It's the fam. It's the Fora fam. But, you have a primary point person, and I think that gives a lot of people comfort. As you mentioned, at larger clinics, there's literally a phone bank of just phone nurses, okay? And so you've never met this person ever in your life, and their only job is to sit there and call negative pregnancy tests that day.
Or answer the phone, or
whatever it is,
questions.
or whatever it is. And so, again, you have to ask yourself, is that something that would be bothersome to me to have a person I've never met calling me and telling me that I'm not pregnant, right? So I think for us, it is very, crucial and core to the model at For Fertility to have a care team for that very reason.
I think it gives a lot of comfort if you're a patient, just saying, this is also if I have a problem, this is who I can go to. This is my touch point versus just I'm going to pick up the phone and call into the abyss and hope that they answer on the other end. But that's another thing. Like, who is my immediate team? Who do I go to? How do I get questions answered? And we have a low threshold because we are small by design. I go to Ricky, they come to Dr. Skillern if Ricky doesn't have the immediate answer. So we're intimately involved. And for all of our patients, like, we talk about you every single day. You and I talk about patients all of the time. So just because you might have Dr. Skillern as your doctor and yet you're seeing me for monitoring, we are in constant communication because that's really going to provide the best care.
Totally.
And it's much more continuous, and we know what's going on so that if I come in after a week of not being there, I'm not coming into that room blind. I know what's happening. I know if we're happy with the cycle. I know everything you've told the patient.
That's right.
And I think that's just important to think about when you're on the receiving end of something that's such a huge investment physically, emotionally, financially, and time that you're setting yourself up for success.
Completely.
I also want to say we do a really good job, and I have been at more clinics than you, but we do a really good job here, so I've seen it more ways, of saying your time is also valuable. And in addition to trying to use it well in monitoring, we're going to try to the best of our abilities to give you a calendar and give you the road of expectations for what we think is going to happen at this cycle. But a lot of practices don't even tell you when the next monitoring will be until you are there. And of course, things should always change based on how you're doing, of course. But having no idea of what the roadmap looks like, that would give me anxiety going through.
100%. And so one of the things, over the course of all these years, it's like, this cycle tends to go this way. I tend to need to see these folks this day of stimulation, this day of stimulation. So at least you have, like you said, some kind of roadmap, some kind of expectations, right? Happiness is expectations minus reality. I say that one a lot.
She says that all the time.
Yes, I do. But we're setting expectations. And to your point, when you're in stimulation, you're in cycle, things, you might be moving faster. You might be moving slower. We might need to adjust your calendar, but you need to go in with some kind of expectation.
Let's pivot for a minute because I think a lot of people choose a practice, maybe because this is where their insurance is covered for IVF. And every single day, you and I see patients, we talk to them, we have a financial team who talks to them. Insurance is not transparent on purpose.
Correct.
It leads, especially when it comes to IVF.
Correct.
And I think if you're using insurance to make your sole decision, you might find yourself disappointed on the back end and at least feel like you didn't make an educated decision. How do you kind of break down a lot of what people experience when it comes to IVF and insurance?
Well, first of all, you hit the nail on the head in the sense that, insurance is inscrutable when it comes to IVF. So you might have two patients that on paper look like they have the same plan, but because this person has this employer, this person has this employer, this or that won't be covered, right? And so, like you said, unfortunately, a lot of people will pick a clinic, oh, that's where my insurance covers. But one thing they don't understand, because why would you, as a layperson, understand any of this? I mean, as a physician, we don't understand sometimes how the plans work. But the point is, oh, my insurance works there. Well, does it though? Because there's going to always be exclusions. So things like, we don't cover the freezing of embryos. We don't cover the testing, genetic screening of embryos. We don't cover, this, that, or
this
the
type
other.
of fertilization.
Correct.
This type
we
of
don't
storage,
cover ICSI. We don't cover storage. And so if you go to Clinic A where they take your insurance, by the time you've paid those exclusions, you actually would have been better off to come, for example, to Fertility, where the lab does not take insurance, but there is a one transparent price. So you aren't wondering until all of your EOBs come in what you're actually going to owe. And that comes back to happiness is expectations minus reality. We're going to provide you with one transparent price. This is what you're going to pay, regardless if you have 2 embryos, 200 embryos, if I had to see you on the weekend, if I had to do this.
Yeah, we're not going to nitpick, oh, you had to come in more because you were over responding, so I'm going to punish you with money.
Right, exactly. Or you had more eggs, so we did more ICSI, and that costs more. And so unfortunately, when you're using your insurance, that's exactly what happens, and you don't know until sometimes months later what you actually owe, and that's a big sticker shock for people. And so I think, yeah, it's important to ask the insurance questions, but you shouldn't be using that in and of itself to make a decision about a clinic, because it's not always better.
Right. It's not always better, and you often find out much later.
You do.
And sometimes it's actually worse.
Oh, no, it is. And that's what I mean. And I think and one of the things that really breaks my heart about patients sometimes is, they'll go somewhere else, they'll use their insurance, they'll fail a cycle. And so then on top of that, you just had that cycle failure, it didn't work out the way you hoped it would. And oh, by the way, here's the surprise bill from your insurance, because now we've looked at all your EOBs and this is what you owe. And I don't think that is necessarily the best for everyone.
No, I also think it's important to say, how we have structured things is so the clinic side and the lab side are different. So the clinic side takes insurance. So when you're coming in for your testing, your blood work, normal things, that goes to your deductible like normal. And the lab doesn't. And it's a very purposeful reason, right? Because if reimbursement is so low that we can't afford to have the best equipment, the best staff, you have to be able to say this isn't actually in the best interest of patients, because if we did this, the quality of care would have to decrease in order to stay open.
Correct. I think there's that, but also, again, just coming back to the transparency, right? Like, if we tell you this is what it costs this from A to Z, whether you have 100 eggs, 10 embryos, whatever it is. We don't punish people or reward people for doing better or less well. It's like we take care of everybody. This is the price of the care that we give you. regardless of your individual idiosyncrasies, your AMH, your age. We're going to take good care of you. This is what that care costs.
It's a good point, because even if you don't have insurance, so outside that discussion,
Totally.
there are a lot of clinics that do not give you, quote unquote, a package cost
Correct.
for IVF.
That's correct.
So, one other way to say this is, an IVF cycle is going to cost this much, regardless of how many blood draws, monitoring, eggs, ICSI, embryos, biopsy, etc. And many other places do line item it. And it might look lower at first glance because they're giving you an unrealistic expectation at times of what may happen. And then if you come in on the weekend, if you are seen more, if you have more eggs, all the points that you pointed out, then suddenly this number is way larger than you thought, and you had no idea that that was what was going to be happening.